The hospital is a unique working environment. Employees may be exposed to potential hazards on a daily basis, as are patients and visitors. That is why it is so important that every hospital employee be trained to recognize potential hazards and prevent injury to themselves and others. In this program, we will address the primary safety issues facing a healthcare facility and its workers. Let's begin with slips and falls. A common source for staff, patient, and visitor injuries, they can likely be avoided through good work practices. Slips may be avoided by keeping floors clean and dry. If you encounter a spill, ask another hospital employee to bring you something to soak up the spill or contact environmental services. However, never leave a spill unattended and be sure a wet floor sign is placed in the area. Should the spill contain a hazardous substance, contact the spill response team or appropriate department according to the facility policy so that the cleanup is handled safely. If you work in an area that uses wet processes such as the decontamination area in central services, use drainage mats or platforms or the appropriate waterproof footgear to prevent slips and falls. And during months of inclement weather, all workers should consider donning safe footgear to prevent slips. If you must get to an item that is out of reach, use a well-maintained, sturdy ladder. Never use stools, chairs, or boxes. Keep aisles and passageways clear at all times. If you are working in a hallway, work on one side at a time to allow for traffic. Not only can power cords be tripped over, but heavy equipment rolling over them can damage the insulation covering, exposing wires. Always hold the cord up, plug into a floor, or tape electrical cords for safety. Back injuries from frequent pushing, pulling, carrying, or lifting account for 1 of every 5 injuries in the workplace. Fortunately, many of these injuries can be prevented with the right work methods. When possible, keep the object you are lifting between knee and shoulder height. If you do have to bend down to lift, bend your knees and lift with your legs. Be sure the weight of the object isn't more than you are able to lift. If it's too heavy, either reduce the weight of the object, ask for help, or use a mechanical lifting aid. Before moving an object, get a good grip on it. Keep it as close to your body as you can, tighten your stomach muscles for extra support, and always practice good posture. If your job requires you to move, transfer, or lift patients, choose the best equipment for the job based on the patient's condition, weight, and whether they are able to help with the transfer. For example, transfer belts allow you to pull a patient rather than lift them. Sliding boards help slide patients from one surface to another. And mechanical lifts are best for patients who are completely dependent or are difficult to move. When preparing the patient for transfer, lock the brakes on the wheelchair or bed, work as a team whenever possible. And when lifting, flex your knees and keep a low center of gravity. Keep your back straight and let your legs do the work, and never twist or bend at the waist. If your job requires repetitive movements, use of awkward postures, or excessive force, you are at risk for musculoskeletal disorders. Here are some tips to make your workstation safer. If you work at a desk, place a computer monitor at eye level. The edge of the keyboard and work surface should be rounded to have pads to protect your wrists and palms from hard edges. Sit in a chair with a good back and leg support, with your forearms parallel to the floor. Use a headset or attachment so you cradle the phone off your shoulder. And remember to take breaks away from the workstation to allow your eyes to rest and your body to use different muscles. If you stand for long periods of time, wear good shoes with arch support and traction. And if you use tools, make sure they are designed for the task in mind. Do not use tools that put pressure on tissues or joints or need awkward postures to make them work. Your facility is required to have a fire prevention plan that is easily available for you to review. This includes a list of all major fire hazards and potential ignition sources that may apply to your position, and the type of fire protection equipment necessary to control each major hazard. To prevent fires, ensure that flammable and combustible waste materials do not accumulate, and that heat-producing equipment that can accidentally ignite is regularly maintained. Fire exits should be clearly marked, and access to the exit should remain unobstructed at all times. Know where the fire exits are in your area, the route that should be taken, and your individual responsibilities in the event of a fire or emergency evacuation. If you see a fire or see or smell smoke, the acronym RACE can help you remember what to do. Rescue anyone in immediate danger. Activate the alarm by calling the fire code, pulling the fire alarm pull station, or by dialing 911. Contain the fire and prevent the spread of smoke by keeping doors closed. Extinguish the fire. If the fire is small and contained, and it can be done safely, attempt to extinguish the fire yourself. The PASS acronym can help when operating a fire extinguisher. Pull the pin, aim the nozzle, squeeze the handle, and sweep towards the base of the fire. Electrical shocks can severely injure and even kill. That is why it is important to operate electrical equipment according to manufacturer instructions, recognize safe as well as potential unsafe equipment, and follow protocol when equipment needs to be fixed. Visually inspect each piece of electrical equipment before it is used, including electrical items brought in by patients. And report outdated inspection stickers on equipment according to facility policy. Plugs on equipment should have at least 3 prongs. If any of the prongs are severely bent, loose, or missing, do not use the item. All cords should be double insulated. If the cord is frayed, the outer insulation is broken, or the cord becomes warm when plugged in, do not use it. Do not overload electrical circuits or use outlets that appear damaged. Disconnect plugs by pulling on the plug, not the cord. Metals are conductors of electricity, as are fluids, including body fluids, saline solutions, juice and soft drinks, and even water from freshly washed hands. They should never come in direct contact with energized electrical equipment or circuitry. And finally, always test equipment by turning it on before using with a patient. If electrical equipment needs repair, report it to the maintenance or engineering department. Take the equipment out of service and place a warning tag on the device. If the device cannot be removed or fixed right away, place a lockbox on the electrical cord plug to prevent the equipment from being used. When the facility is remodeling or adding service areas, employees working or passing through construction areas will need to practice safety precautions. Do not enter areas that are roped off or clearly marked with warning barriers, especially if there is active construction going on, and always park in designated areas. In order to ensure the safety and confidentiality of patients, construction workers inside of the facility should wear identification badges at all times and never enter occupied patient areas without first notifying a clinical staff member. In fact, if workers are not properly identified or you see suspicious activity, report it to security or the facility's construction supervisor. If construction work results in unexpected shutoff of services to patient care areas or emergencies such as loss of medical gas, utility or power, broken water or sanitary sewer lines, or water seepage, be sure to report the problem immediately. You have the right to understand the hazards of the chemicals you may encounter in the healthcare environment and how to safely handle them. OSHA has updated its Hazard Communication Standard, or HCS, bringing the U.S. into alignment with the globally harmonized system of classification and labeling of chemicals, or GHS. This change is expected to prevent many workplace injuries, illnesses, and fatalities. The HCS requires chemical manufacturers, distributors, or importers to provide safety data sheets, or SDS, to communicate information on the hazards of the chemicals they produce or import. This information is now presented in a user-friendly 16-section format that contains information about each chemical, its hazards, safe handling practices, and emergency control measures, among other information. For example, Section 8, Exposure Controls and Personal Protection, will contain information about exposure limits, engineering controls, and ways to protect yourself, including personal protective equipment, or PPE. Familiarize yourself with the new format and be sure you know where the SDS and the Hazardous Communication Plan are in your work area and how to apply the information they contain. The revised HCS also changes the labels on chemicals so that they provide quick visual references regarding hazards and how to handle the chemical safely. Labels for hazardous chemicals must include the following information and be maintained on containers: A product identifier that includes the chemical name, code number, or batch number, name, address, and phone number of the chemical manufacturer, distributor, or importer. Pictograms or graphic symbols used to communicate specific information about the hazards of a chemical. The signal word, which indicates the level of severity of the hazard and the potential hazard. For example, danger is for more severe hazards, and warning is for less severe hazards. A hazard statement, which describes the nature of the hazards, including the degree of hazard where appropriate. And a precautionary statement, which describes the recommended measures to minimize or prevent adverse effects from exposure, such as keep away from heat. Your employer might use the information on the label to ensure proper storage, to help you understand the various hazards associated with a chemical, or how to quickly identify the appropriate first aid. If you work in an area where hazardous or corrosive materials are used, always wear safety glasses, goggles, or face shields as specified on the SDS. This is in addition to other PPE that may be required for a particular task. Should a hazardous chemical splash in your eye, immediately proceed to the nearest eye wash station. Hold both eyelids open in running water for at least 15 minutes and roll the eyeballs so that the water will flow all around the eyes and under the eyelids. Contact your supervisor and get medical help. If your job requires that you work around radiation, you can reduce the amount of radiation exposure by minimizing the amount of time you are exposed, increasing the distance between you and the source of radiation, and increasing the amount of protective material between you and the source of the radiation. For example, during radiation, employees should only be in the room when absolutely necessary. If staying in the room, wear a lead apron and stand as far away as possible from the source of radiation. If your facility issues radiation badges or other devices, be sure you follow procedure so that your exposure can be properly monitored. Contact your facility radiation safety officer with any questions. In recent decades, our country has had to recognize the fact that terrorism is a real threat to our communities and will almost always affect our hospitals. Should there be an actual bioterrorism event in the hospital or in the community, your facility's incident command system will implement the appropriate emergency operations, which will include the proper PPE to wear, backup communication systems, and other procedures for an organized response based on the hazardous substances or conditions present. Be certain that you become familiar with your facility's bioterrorism response plan and the safety protocols designed to keep you and others safe. In addition to bioterrorism events, disasters such as tornadoes, floods, earthquakes, plane crashes, or multi-car pileups can all have a great impact on a facility. In order to respond to the large numbers of patients that can arrive needing immediate medical attention, your facility has instituted a disaster preparedness or mass casualty plan. This plan is available as part of a safety manual in every department of the facility, and it is imperative that you know procedures, your individual role, and who to report to in the event a disaster code is called. If there is a power outage or water or phone lines are disrupted during the disaster, refer to the safety manual for policies and procedures. For example, generators will need to be activated, and two-way radios may be used as backup for internal communications. If your facility cannot support patient care and treatment, an evacuation may be called for. Again, follow protocols and procedures for the relocation of patients and staff. Finally, preparedness is the key to an organized and thorough response. Take seriously the bioterrorism and disaster drills conducted at your facility so that you are ready and prepared to perform your important role should an event take place. Unfortunately, violence in hospitals has increased exponentially in recent years. OSHA defines workplace violence as any physical assault, threatening behavior, or verbal abuse occurring in the work setting. Your facility endorses a zero tolerance for workplace violence in any form, which can range from offensive or threatening language to homicide. Take part in training offered by your facility to help you learn the possible sources and risk factors of violence, the signals for escalating agitation and assaultive behavior or criminal intent, how to interact with a hostile individual appropriately, and how to react properly to events by following your facility's security plan. It's important that you report any and all physical assaults and threats of assaults. These reports are essential to creating a culture of safety within the facility. You should also become aware of the potential hazards of stress in the healthcare workplace. Whether stress comes from the hectic pace, from daily encounters with life-threatening injuries, or from violent confrontations or unplanned disasters, stress can take its toll. It can cause ulcers, migraines, loss of appetite, emotional disorders, trouble sleeping, and increased use of drugs and alcohol. Stress can also affect your attitude and behavior at work and at home. Your facility has an employee assistance program that offers stress management programs to help you handle daily stress more effectively. It also offers psychological counseling for those affected by work or personal stress, and for individuals affected by working during a disaster or a violent event. In addition, there may be an organizational change program with methods to help you reduce work-related stressors. Be sure to ask about the assistance available to you. And finally, you should know how and with whom to report staff, visitor, or patient injury. Within the facility, there are 3 departments that handle safety issues: the safety officer, risk management, and employee health. The safety officer and safety committee create and enforce protocols and procedures that all employees must follow. Contact the safety officer or any member of the safety committee if you have a safety concern or suggestions for creating a safer environment. Contact the risk management or patient safety department should there be a situation or event that does or could cause personal injury to a visitor or patient. These situations may include medical or medication errors, falls, and death within 48 hours of admission. All events must be reported to the Risk Management Department with an incident or occurrence report within 24 hours of the event. If the event is an emergency, contact the risk manager directly. And finally, contact the Employee Health Department if you or a team member are injured during regular work hours. For all safety concerns that occur after hours, be sure to follow your facility's protocols and procedures. In this program, we have reviewed the top OSHA mandatory topics for safety issues that can occur at any healthcare facility. Be attentive to possible dangers, respond by acting to eliminate hazards, and work to prevent them from harming staff or patients in the future. We can have a safe environment for both healthcare workers and their patients if we remember to always practice safety first.